Allergy season is officially upon us, and joining us today is UofL Health ear, nose, and throat nurse practitioner Kari Kirk to give us a little bit of insight and best practices on how to manage our allergies this season. So thank you for being here with us.
Absolutely. Thank you for having me.
Of course. First things first, what is it about the Ohio River Valley? Because I am from New England originally, and I've never dealt with allergies. I moved here in 2015, and even today I am stuffed up. The allergies are real.
Yeah.
So what is it about this area that really makes those allergies a little bit more prominent?
That is a great question and a very classic story in this area. So the Ohio River Valley is a river basin, so it makes us more prone to humidity, which is making us more likely to have mold. The plants grow very pretty here. We have our beautiful Kentucky bluegrass, but I think we really do pay for that with our allergy symptoms.
And can you give us some tips and tricks for those of us that are really struggling? Specifically, the difference between an antihistamine and a decongestant. When should I be using one or the other?
Absolutely. It gets really confusing, so it's kind of good to think of allergy treatment as two branches on a tree. Branch one is going to be environmental control, so you want to look at getting a really good high quality air purifier, something with a HEPA filter. Even on those beautiful spring days, you want to let all that fresh air in, but unfortunately what's happening, pollen is coming in with it. We're very allergic to that, so keeping those windows closed would be helpful.
Okay.
Washing your sheets in hot water, that would make a huge difference on the environmental side of things. From there, then you think about medications, and my favorite thing would just be good old saline, right? We're gonna get some cheap, dirt cheap intranasal saline. You're gonna keep it in your shower every day. You're gonna rinse your nose out, and what that's gonna do, it's gonna wash out any pet dander, pollen, those little microparticles that get in your nose and cause you to have allergies, and you're gonna flush them down the drain and say bye-bye. And then from there, I would use something like a good nose spray like Flonase. So you wanna use like a cortisone nose spray. Nasocort's another good choice. And then antihistamines would be another good second option. I would save decongestants for when you're actually congested. So if your nose is stuffy and you're not breathing, that would be a good time for that. Be very careful though, because they can raise your blood pressure, so it's not suitable for everybody.
Tell me a few signs and symptoms of allergies, specifically when they're severe enough to where you might need to go see a doctor.
Okay, yeah, absolutely. So classic ear, nose, and throat manifestation of allergy symptoms would be nasal congestion, sneezing, itchy, watery eyes, posterior nasal drainage, throat irritation, cough. It can even manifest in your ears, ear fullness, pressure, popping, sometimes muffled hearing loss, but that's the classic ENT picture of environmental allergies.
Okay. Is there any moment where, it could get a little bit more dangerous?
Yes. So what we want to always have on our radar is this allergies? Is this asthma? Or is it a combination of both? Could this also be chronic sinusitis or some sort of an anatomic, malformation like a deviated septum? When it's that, or you're just not sure, we recommend coming in for an evaluation.
Well, I am feeling prepared to handle my allergies this season. Thank you, Kari, so much for being here today.
Thank you for having me.